Now it gives me great pleasure to recognize the American Academy of Sleep Medicine's 2021 award recipients. First is the Mark O. Hatfield Public Policy or Advocacy Award, which recognizes contributions to the development of public policy that positively affects the sleep of all Americans. This year's recipient is Indira Gurubhagavatula. As chair of the Academy's COVID-19 task force, she has been instrumental in leading the development of our guidance and resources, helping members respond to the challenges of the pandemic. She also served as chair of the Sleep and Transportation Safety Task Force, Occupational Sleep Wellness Presidential Committee, and Public Safety Committee. And she was also the co-chair of the Work Shift Length Guidance Task Force, which was a joint initiative between the Academy and the SRS. Her research has focused on screening for sleep apnea in high-risk populations, including commercial truck drivers, law enforcement officers, and those with cardiovascular disease. She's an associate professor of clinical medicine at the Perelman School of Medicine at the University of Pennsylvania, director of the Sleep Medicine Fellowship at Penn, and director of Sleep Medicine Clinic at the Crescent's VA Medical Center in Philadelphia. Congratulations, Dr. Gurubhagavatula.
Thank you to the Academy for this prestigious award. This result was made possible because of the many mentors that I've been fortunate to have. Dr. Alan Pack. Alan, thank you for introducing me to the science of sleep public health by addressing sleep apnea in commercial drivers and in law enforcement. Dr. Sam Kuna and Rich Schwab, thank you for supporting my professional development from the very beginning. Doctors Sigrid Vizi, Eileen Rosen, Jeannie Naidu, thank you for your generous listening, advice, support, and encouragement at critical times in my career. I also really want to thank the Academy for all the resources they gave us to pursue what was needed through the foundation and also through the dedicated staff and through the board liaisons who supported us in countless ways. And all of the teams that they assembled, full of passionate and hardworking individuals, people like Dr. Shannon Sullivan, Dr. Michael Berneking, and so many others. You know who you are. Thank you for participating so fully, generously, and enthusiastically. I learned from you, and we have a lot of fun together. I also thank the many, many collaborators and colleagues. Some of you are at Penn, some of you are across the country, and some of you are worldwide. All of you have inspired me to think, to innovate, and to create. I'm also grateful for my patients who shine a light on where the greatest clinical and research needs are. And for our trainees, thank you for your curiosity, your energy, your leadership, and your love of learning. And I am also profoundly grateful for the support of my amazing family. All of you who dedicate yourselves to promoting healthy sleep in the interest of public safety and public health, you really are heroes and role models. Thank you all for your partnership in this mission. And thank you again to the Academy for this distinct honor.
Next is the Excellence in Education Award, honoring outstanding contributions in the teaching of sleep medicine. The recipient is Scott Williams. Dr. Williams is dedicated to enhancing the professional development of the entire sleep team. As co-chair of the Sleep ISR Gold Standard Panel, he has helped sleep technologists develop proficiency in scoring sleep studies. As chair of the Sleep Technologist and Respiratory Therapist Education Committee, he helped develop an educational track for sleep technologists at the sleep meeting. He has also educated key decision makers about the importance of sleep as part of the Surgeon General's Performance Triad Sleep Working Group, as a consultant to the White House Medical Unit, and as an acting consultant to the Army Surgeon General for Sleep Medicine. A Lieutenant Colonel, Dr. Williams is Director for Medicine at the Fort Belvoir Community Hospital in Fort Belvoir, Virginia, and an Associate Professor of Medicine and Psychiatry at the Uniformed Services University of the Health Sciences. Congratulations, Dr. Williams.
Thank you all so much for this award. I am truly honored and humbled to be recognized alongside some of the great names in sleep medicine. A wise mentor once told me that when it comes to supervision and teaching, polygamy is a good thing. And I've been blessed to have many wonderful teachers and role models whose example I continue to try to emulate. There's so many people I want to thank, and I apologize that since the AASM has only given me a total of 2 minutes, I will undoubtedly leave some people out. To begin, though, I want to thank my loving wife, Jeannie, and our 2 children who try their best to be as quiet as an 8 and a 7-year-old can be when we turn our home office into a recording studio every few weeks to create the ISR monthly video record review. To my program director, Chris Lettieri, who taught me almost everything I know about sleep medicine, but don't tell him that. His ego is big enough as it is. He once told me, "You will make a way better attending than a fellow." And I'm still not sure if that was a compliment or not, but I'll take it as one. To my staff mentors during fellowship, Dr. Victor Steiger, Ron Kramer, Dr. Arnold Eliason, Dr. Judy Owens, Dr. Daniel Lewin, thank you for putting up with me and teaching me. Dr. Emerson Wickwire, who showed me the power of CBTI and whose phrases continue to resonate most powerfully during clinical and didactic sessions. Emerson, you're truly a wonderful friend and teacher. My colleagues at the Walter Reed National Military Medical Center, Dr. Jacob Collin, Dr. Vin Capaldi, Dr. Aaron Hawley, Miss Natalie Bilodeau, and Dr. Andre Kramsoff. To my ISR co-conspirators, Dr. Mark McCarthy, Dr. Michael Zacek. You think by now I would know how to say his name, but I still don't. Ms. Fabernet, Mr. Claude Albertario, and our pediatric colleagues led by Dr. Brian Robertson. As the referees in this ongoing attempt to decipher squiggly lines, I truly value your wisdom and feel smarter every time I speak with you. The Education Committee team, especially Dr. Shalini Paruthi, whose leadership had been so vital in shaping how the committee functions, even years after we have since left it. To the many staff in the AASM who have put up with my delayed responses to emails, given me gentle nudges when needed, and always keep our committees on track. Becky, John, Jason, Matt, Chris, Brittany, Melissa, Jordana, Catherine, you're all rock stars. Mr. Steve Van Hout, for roping me into the ISR these many years ago. It's wonderful to see your successes and how you're guiding the ASM in a very positive direction. And finally, to my allied professional colleagues in the SRS, the AADSM, the ABDSM, and the AAST, the synergy present in sleep medicine is one of the things that makes it a truly special field. May we continue to improve the relationships amongst our organizations and accelerate the many discoveries that are yet to come. Thank you once again.
Our next award is the William C. Dement Academic Achievement Award, which recognizes exceptional initiative and progress in the areas of sleep education and academic research. This year's recipient is Terri Weaver. The first nurse to serve on the Academy's board of directors, Dr. Weaver paved the way for advanced practice providers to become more involved in the Academy, and her work on the AASM Foundation Development Council helped expand career development programs for sleep and circadian researchers. Her lasting impact on sleep medicine includes her research exploring the effect of daytime sleepiness on daily behaviors and her development of the functional outcomes of sleep questioning. Dr. Weaver is Dean and Professor of Nursing at the University of Illinois at Chicago College of Nursing and Professor in the Division of Pulmonary Critical Care, Sleep, and Allergy. Congratulations, Dr. Weaver.
I am incredibly honored to receive the William C. Dement Academic Achievement Award. Having known Dr. Dement and his tremendous contributions to the field, I am very humbled to receive an award in his name. I was extremely lucky to have had phenomenal mentors that have guided my career and molded me as a scientist. It was a life-changing experience to be part of the University of Pennsylvania Center for Sleep and Respiratory Neurobiology, as it was known during my time at the University of Pennsylvania, and to have reaped the wisdom, guidance, and opportunities provided by Dr. Alan Pack and Dr. David Dinges, as well as Dr. Lois Evans from the Penn School of Nursing. The fact that I am in the field of sleep and also that I became a dean, I owe to the encouragement and persuasion of Dr. Pack. I am so very grateful to Dr. Sam Kuna for his partnership, as well as many other valued scientific collaborators. In particular, I want to thank the pre- and postdoctoral fellows who worked with me to advance the science and went on to build their own stellar careers. A very special thank you to the Awards Committee and the Board of Directors of the American Academy of Sleep Medicine, many with whom I've had the privilege of serving on the board, who have recognized my work, my contributions as a leader and as an academic, and enabled and supported me as we forged new directions in sleep health. Finally, I could not have achieved what I have if it weren't for the love and support of my wonderful husband, Bruce Fiedler, and sons, Matthew and Scott. They were always there for whatever I needed, whenever I needed it, and for that I am very grateful. Thank you.
Finally, we present the Academy's highest honor, the Nathaniel Kleitman Distinguished Service Award. It recognizes a member's dedication to the sleep field and significant contributions in the areas of administration, public relations, and government affairs. The recipient is Safwan Badr. For more than 30 years, Dr. Badr has been a leading advocate for high-quality, patient-centered care. He served as president of the Academy from 2013 to 2014, challenging us to consider new paradigms of care that would achieve the triple aim through integrated value-based models. He was the founding director of the Wayne State University Sleep Medicine Fellowship Program, and he has mentored numerous trainees and junior faculty members who have launched successful academic careers. Dr. Badr continues to support young physician scientists as a faculty member for the Academy's Young Investigators Research Forum and as a mentor in the AASM Foundation's Sleep Research Program for Advancing Careers. His own research has advanced our understanding of ventilatory control and airway mechanics during sleep. Dr. Badr is a professor and chair of internal medicine at the Wayne State University School of Medicine and a staff physician at the John D. Dingle VA Medical Center in Detroit. Congratulations, Dr. Badr.
I'm honored to be the recipient of the AASM 2021 Nathaniel Kleitman Distinguished Service Award. Being recognized by my AASM family means a lot to me, as I've always viewed serving the mission of the AASM as true labor of love. I also feel very fortunate to having witnessed and observed the growth and evolution of this field over the past 30 years, from an esoteric scientific endeavor to a major medical discipline, helping people live better and healthier lives. While awards are given to individuals, credit belongs to teams. It is the team of volunteers and AASM staff working diligently together to advance a higher goal. And that may be the secret ingredient. Thank you very much. I'm very grateful for this award.
I thank these award recipients for their contributions to the Academy and to the sleep field.